Welcome to This Just In, the show bringing you the latest advancements in healthcare, strategy, innovation, and public policy. And now, for the fastest voice in healthcare, here's your host, Justin Barnes.
Thank you for tuning in, and welcome to This Just In. I'm your host, Justin Barnes. In these segments, I'll bring you the latest advancements in healthcare, strategy, public policy, and innovation. As always, we're broadcasting from the This Just In studios on the Business Radio X network, as well as the HealthcareNOW Radio network. And talk about these great networks, I'm very excited to announce that I'm teaming up with my broadcast partners, and we're hosting a live show on Wednesday, August 28th, from 11 a.m. to 2 p.m. Eastern from the This Just In studios here in Atlanta. Similar to our live broadcast each year during the annual HIMSS conference, I'll host a great slate of industry's most sought after CEOs, CIOs, care providers, policy leaders, and healthcare visionaries. I even expect a special guest from ONC and HHS, and I should be finalizing that here in the coming days, and we'll make those announcements for sure. But mark your calendars, please, for August 28th from 11 a.m. to 2 p.m. Eastern, and you can stream us live at brxlive.com, thisjustinradio.com, and certainly HealthcareNOWradio.com. We expect over 50,000 listeners due to our broad network reach, so be sure to tune in. For this episode, though, my 181st episode, we have a very special healthcare thought leader guest and good friend of mine, Dr. Brian Hill, co-founder and chief medical officer of HIPnation Healthcare. Welcome to the show, my friend.
So great to be back, Justin. It's always just fun to engage and converse with you.
Thank you, my friend. I'm looking very forward to this show, and I know that you have a lot going on, a very busy guy, but I know consumerism is a very important topic. It's been growing probably over the last decade, right? 15 years. And then we're going to continue on my focus. My last show was focused on consumerism healthcare, how to be a better buyer, really on the pharmacy and PBM side and creating more transparency in that world and touching a little bit of policy. But today, and I know you're an expert in that space as well, but today I want to shift a little bit more down to kind of the individual level, because the other one is more on the corporate side, some individual best practices. But I want to kind of focus on what people, everyday human beings, all of us can do at the individual level, whether we're covered by health insurance or not, but there are great ways to be a better healthcare consumer. But even before we get there, I'm going to ask you why it's so important to be one. But I think some people know, because this is just becoming a larger expense every single day for all of us. I mean, our healthcare expenses rise really every day. You don't realize, every year it goes up. No, actually every single day, your healthcare, your individual piece of your healthcare cost expense is going up, and we'll certainly dive into that. But it's something near and dear to my heart. It's near and dear to your heart. It's also why we're very close friends. But I'll even tell you a quick story before we dive into Dr. Hill. About 3 weeks ago, I was at my local Costco, which I love Costco for a lot of reasons. I think you do as well, Dr. Hill.
I do.
Yes. And right in front of me, I was picking up a prescription, and in front of me was Clark Howard. And Clark actually used to live 3 doors down from me, but now he moved about 15 doors away. But he was there at Costco, and all I got to say is he is exactly as he is in person. I mean, on the radio, as he is in person. He literally he was buying, I think, 3 different things, and I don't actually know because I didn't listen to what he was buying specifically, but he was buying 3 different medications, and maybe 4 for different people. And he was actually going down every single price, and he had it in his phone. And he balanced up what they were offering and what they were charging him for to what they had marketed and what he had found in his research. It wasn't like, I think I'm a good healthcare consumer, and Dr. Hill, I know you're a good healthcare consumer, but we have nothing on Clark Howard. He literally made sure, I just picked that bag up and walked out, hey, thank you, have a great day. He literally walked through all the medications, and then he actually checked the prices of each single one, and one of them was, or 2 of them were not accurate in some way, and he debated. He said, well, is this one cheaper then? Because he knew that they were very similar, if not exact, but he was balancing me 2 different medications. And it was just, I couldn't believe how specific and exact he was, and I was just very impressed. So anyhow, I know you're amazing, but that was pretty remarkable that he was that.
That's awesome.
Isn't it cool though? So, yeah. But before we dive into all the consumers and best practices, because that was kind of just one of them, but from Clark Howard specifically. But you have an amazing venture that's beginning to really pick up some great steam. So tell us about HIPnation before we dive into some of the healthcare consumerism stuff, Dr. Hill.
No, great. Thanks, Justin. And that is a great story. It's great to hear somebody like Clark out there living what he preaches.
Yes.
And finding the best way he possibly can to make healthcare even affordable for him.
Yes.
And so our goal, so HIPnation. So I am the chief medical officer, actually one of the co-founders of HIPnation. And our vision is actually pretty similar to Clark Howard and what Clark Howard's trying to do.
Mm-hmm.
We are an organization, a business that has brought physicians together. In the parlance of probably the people that are on the phone here would understand, we've created a micro network. And what we do is we take our community of physicians and caregivers, and we do direct-based contracting to either individuals or employers in order to provide healthcare services to them. So we, in essence, try to do what we can to remove as much of the insurance interaction in the world of healthcare out of the physician's office. And in doing so, it allows us to provide a higher quality level of care at a lower price. And our foundation is very simple. Our foundation, when we go in and provide our healthcare services to an employer or an individual, the foundation is great primary care, so that when somebody joins up with HIPnation, they get 100% access to their own personal primary care doctor, a concierge level of service, if you will. And our doctors are just paid on a membership-based model, so that there's no insurance in their office, there's no distraction in their office. The individual, the employer knows exactly what they're paying for primary care services because it's paid on a flat monthly base rate. And since our primary care doctors don't deal with insurance, they don't have to deal with a whole back office of high-cost administrative people, and therefore they are able to provide a lower-cost service, and that helps drive down the cost of care for employers. And then we wrap around that primary care physician a micro ecosystem or a community of specialists who provide payment at the point of service rates for all of the care that can be delivered in the outpatient space. We do direct contracting for labs, for imaging, for specialty procedures, ambulatory surgery, specialty-based consults. And again, since we do payment at the point of service, those services now are price transparent. People know exactly what they're paying before they buy it. And same thing in the primary care space. My specialists don't have to deal with spending money to chase money to collect those dollars, so they can provide those services cheaper. So we provide great primary care, low-cost specialty care, and we can sell those services to individuals and employers and wrap insurance products around that actually work in wonderful synergy with us to really create a full healthcare solution for people.
Love it. Love it. Congratulations. And I think after meeting you and even learning more, I thought I was a pretty good expert on healthcare consumerism. But once I met you, I realized I was not. I learned a lot from you. And so one thing I did learn from you is I was actually using my deductible as for my prescriptions, and realized I'm paying my prescriptions with Humana. Sorry to say, was $25, which is basically paying my deductible. When I went to Costco and asked them for the same medication, I was buying $30. I'm sorry, 30-day supply for $25 was my copay. Found out I could get a 90-day supply from Costco for $9. Or no, sorry, $12. It was $9 for 30 days, $12 for 90 days. So that's number one best practice right there is if you can afford to buy in bulk. It was an extra, I think, $3 or $2.85 for me to buy 90 days rather than 30 days. Saves all the gas running back and forth. And it doesn't cost that much more. But if you buy it individually, it would have been $18. But if you think about all that, if I had done that through Humana and through my copay, oh my gosh, it would have been literally 1,000% more. So anyhow, I mean, really look at what these things cost. And you don't always need to use your deductible. To your point, you put insurance in its appropriate spot, copays and deductibles in the appropriate spot, and you do save tons of money. I did. I ended up, when I actually joined HIPnation and switched out of you call them the BUCAs, the traditional insurance plans, Blues United States, I dropped my healthcare costs 60% monthly, which is 60% annually as well. So anyhow, that's why I felt it was important to learn more about healthcare consumerism. But you're my guest. I want to ask you, why is it important to be a healthcare consumer?
Well, no, and that's, again, Justin, just another great example out there yourself of how you're living out the really ideals of healthcare consumerism. And the reality is, and this is the difficulty I think we all see when we're facing this in society, is healthcare costs, you even mentioned at the introduction, continue to go up every year.
Yes.
And those healthcare costs are the cost of services that people are purchasing, and those healthcare costs are also reflected in high and rising insurance premiums. And it's gotten to the point where so many people have just kind of thrown up their arms, they're throwing their arms up in the air and just say, I just can't afford healthcare services. I'm just going to wing it out here, and I'm not going to access healthcare because it's too expensive. Instead, what we really need to be doing is approaching healthcare just like another consumer good and say, how can I find the best way to access lower cost healthcare services and not actually have to pay, these artificially inflated rates that we're oftentimes seeing through things like co-pays that you just mentioned for pharmaceutical products that you could buy cheaper by just paying at the point of service through the pharmacy. And the same thing even comes true into physician offices that you can oftentimes get a lot lower cost healthcare services by actually doing direct payment at that point of service. So consumerism actually starts driving access to healthcare and driving down the cost of expenses for people.
Yeah, you bring up a good point, and we talked a little bit about this off air, but people research their cars, vacations, even, what kind of watch they're going to buy more than they research their health care. I mean, that is baffling. First of all, I was that, so it's not completely baffling, but now in this day and age with how much healthcare costs, I mean, people are paying, even individually or even with their businesses, $2,000 a month. $1,500 to $2,500 a month, the average family pays to access healthcare. Then they have a large deductible they have to get across. So, yep. I mean, I would be researching that. I'm in the hundreds. I mean, I think for my wife and I, we pay less than we pay $450 for the most amazing care on the planet, and it's $450 a month. So, and it's we're very, very fortunate. But we found HIPnation, and we found, some great solutions out there. So.
And that's the sad part of what we kind of see in today's society is we've almost devalued healthcare so much because it is almost a bit of a black box out here.
Right.
That the thing that is the most important part of our existence, I mean, our well-being, our health is such a huge part of our human capital, and we're ignoring it. We're not maximizing it and pursuing it. A statement I had a meeting the other day with an employer, and a 55-year-old gentleman, and he said, I haven't seen my primary care doctor in 5 years. And I asked him point blank, I mean, you own a beautiful car sitting in the parking lot. You take that to the dealership and have it, looked at every 3 months. And
Exactly.
Yet the thing that's the most valuable, you're not pursuing the level of care and attention that it needs. So
true. So I lost a really close friend, was that person who drove a Rolls Royce. I loved hanging out with him. He's an older gentleman, but he's one of my very best friends on the planet for a long time. And he never saw the doctor. And he died of stomach cancer because they never caught it. At the time they caught it, there was 2 softball size lumps in his stomach. And he died within 7 months of finding out, but he never went to the doctor. It was like 5 or 6, 7 years since he had gone last. And if he'd gone every once a year, I go once a year to see my doctor and get a clean bill of health. And, but when something happens, you got it. And, you got to catch it ahead of time. You know that.
Yeah. And that's and I'll tell you, part of our mission, and, even we talk about HIPnation, and I talk about that a lot, but really the mission behind what I'm trying to do in healthcare, and I know you, because I know your heart as well, Justin, is we're really going, how do we get healthcare to people in a way that's affordable and accessible? How do we actually drive this idea of consumerism forward to allow healthcare to actually meet the needs of the consumer? Make it affordable, make it accessible, make it patient-centric and service-oriented. We need to do that because I was called to go into medicine because I love taking care of people and making them healthy and making them well. And if our system is falling short, then we need to be ourselves really aggressive about changing it. And consumerism is one of those pathways, that we can really make a difference in people's lives.
Very true. And I failed to mention at the top of the show, you are a doctor, but you are one of the most amazing urologists. Now, thankfully, I've never had to see you, so I'm just going to go on record. However, I know you're an amazing doctor and urologist here in Atlanta because I've heard from dozens and dozens and dozens of people that love you and know you and love you. So and have been your patient.
Well, thanks. Thank you.
So
I'm blessed to do what I get to do.
Amen. So what are a few? I covered a couple. I get very passionate, as everybody knows. My listeners know I get very excited when I talk about this topic. But I covered a couple best practices. About Costco and buy, and not even using your deductible when it's not needed, stuff like that. But what are a few best practices that you would share on how to be a better healthcare consumer?
Yeah, certainly. And first and foremost, it is a mindset change. I think first people have to make that decision that they are going to become actively engaged in their healthcare. It's not a passive process anymore. It used to be that time gone by where we would go in and just listen to our doctor, do what the doctor tells us to do, not really create any questions around, what our physician is doing, or certainly even, express any, questioning about, what they're ordering, why they're ordering. And so it really does, I think, initially take a process of making the decision to be engaged, one. And then two, in this idea and this, I think, vision of today's healthcare system, the patient should be able to approach their physician and actively engage with the physician in medical decision making. And that means that the physician needs to be able to give that same feedback back to the patient. And patients have a tendency if the physician isn't engaging with them in the way that they want and participating with them the way they want, they oftentimes just accept it and they continue to see that physician and keep up with that physician. So, and open and honest that if the physician isn't meeting their needs and really engaging in a conversation about how they are helping make me healthy and make me well, then I need to move to somebody else. I need to be an advocate for myself, because if I'm buying a service from, somebody who's mowing my lawn and they're doing a terrible job, I'm not going to continue to pay them and continue to use them. I'm going to be a consumer and I'm going to go buy someone else who's providing a better service. And we need to be carrying that level of expectation for our physicians.
Yeah,
and so I think just that initial engagement is the key part.
Yeah, and feeling the initial engagement and then feeling confident in taking charge of your healthcare. It's your life, it's your body, and don't ignore it. Like I said, I gave that a great example of my friend who passed away. I think he was 77 years old, a phenomenal guy, but would not see a doctor. He could certainly afford it, but would not see one, and then died within 7 months because he didn't see a doctor, didn't have those routine physicals. It would have been caught years and years and years in advance. They thought it was growing in his stomach probably 5 to 6 years. I mean, it was a long. I mean, that was a long time that you could have caught that. And so
people should be looking at their physician as an advocate for them. I mean, we like to talk about, that physician should almost be like that doctor in the family mentality, that you should really be walking hand in hand together with the physician as an advocate for your health and wellness. And if you're not getting that feedback from your physician, then it really is time for you to really assess whether or not that physician is the right person for you.
That's great. So one thing near and dear is obviously healthcare costs are rising, insurance costs are rising. Let's not go down that path. However, how, giving, again, consumerism best practices, how can someone find a higher quality healthcare or insurance? And obviously those are not the same to you, and I totally agree. Insurance is one piece. Healthcare is completely separate. It's all intertwined, and that's what's really driving up the cost and way too much utilization. But how do we find better healthcare and better insurance options?
Yeah, certainly, and that does become a difficult play in today's world, and some of it is just because of the sclerosis of the system. Has made it so that there is not a lot of innovation that's going on in the marketplace for health insurance and even health care. The beauty is that we're starting to see more and more, which I love. Mm-hmm. And so the places and the ways that I approach these, and you're right, health insurance and health care are two very different things. The health insurance is a paid-for model for the service of health care. So on the healthcare side, again, I take a look at trying to find the quality of physician by making sure that I can sit down and have a physician that can spend time, create a relationship with me, and has that active engagement in my meeting my needs and really kind of finding a way to make sure they're focusing on the health and wellness of me. And so the difficulty of looking out there and trying to find that online, I know a lot of people go online and they look at things like health grades and they look at vitals, and there can be some valuable information in those, but most of those are very blunt tools. of just kind of rating physicians or physician offices, based on the anecdotal experience of a patient. And so the one pathway that I always recommend to my patients is one, talk to family members, friends, people in your local community, to try to see if you can really get more of that robust evaluation from those that are in the community about the physicians that they are seeing. And as a physician, my always go-to is, I generally know who's good and who's not in this world. Talk to your physicians. If you have friends that are physicians, if you're seeing specialists, and really it's that wonderful kind of cliche of a question, but ask them, who would they have their wife or their husband go see? And try to kind of get some of that inside baseball and really put it to them a little bit to make sure they're really giving you an honest answer when they do so. So really trying to get into that nitty gritty of finding that quality physician oftentimes in today's world really becomes, more trying to, find those in your local community that can help you. There are some services that are being developed and looked out in the marketplace right now that are trying to give us better insight into physicians in the community. There's some innovators and companies like Quantros that are looking out at quality metrics for physicians in the community. Certainly hospital-based groups, that we all know very well. I know you do the Leapfrog group really well, Justin.
Yes.
They're looking at the hospital systems and trying to find quality of care metrics to help us direct the care level of the hospital. So certainly some tools that are out there to try to help. But most of it is really, I think, you as an individual being willing to walk away. If the physician is not meeting your needs, and then you have to be willing to walk away to somebody else until you find that real relationship for you.
So a follow-up question, because and this is a tough one. How can you find a price of healthcare costs? Because you and I are big supporters of transparency, but when it's not offered or not easily found, how can you get a price of a procedure or a service or an appointment?
Yeah, see, and you're right, Justin. That's the really kind of crazy part of today's world. I think if anybody who's listening to this will tell you they've called the hospital and they, say, hey, what's the cost for your gallbladder removal? It's almost like you'll hear crickets on the other end of the phone. It becomes a very difficult thing to find out. And some of that's because of the way the insurance system is put together and set up. Certainly, most of us know Healthcare Blue Book, to be able to look online and try to find Healthcare Blue Book as a way to try to find an average of pricing in a local community. But certainly, calling, calling, and I'm a big, fan of outpatient imaging centers, outpatient ambulatory surgical centers. Calling and actually finding out the cost of services is easier oftentimes in those types of situations, than what you'll generally find in the larger hospital-based systems. And then even some of the insurance companies, while, again, I might not be the biggest fan of the wonderful bukas that you mentioned, sometimes being able to reach out and actually speak to the customer service and try to find out exactly the cost of care delivery, they can and oftentimes should be able to tell you the cost and hopefully direct you to some of the lower cost centers, like ambulatory surgical centers and imaging centers.
Excellent.
Within HIPnation, what we've done, and this is the beauty of what I love within HIPnation, is we have gone out there ourselves and gotten those payment at the point of service rates for every ambulatory surgical center procedure that can be done in the outpatient space, office-based procedures, specialty consults. We have all of those pricing, because we find that so important to create a consumerism-based model. So here, at least in the Metro Atlanta area and our growing footprint in the Southeast, within our community, we can actually tell you exactly what the pricing is before you go in. The second beauty of what we do is the insurance-based products, like you mentioned, the one that you're using there, Justin, and the one that we bring to employers. We actually create the freedom within those plan designs to allow people to actually pay for our low-cost services and actually apply them to the deductibles, whereas most insurance-based products, if you're, again, back in that world of Blues and United, Cigna, and Aetna, you have to use their high-cost, rates, rather than the lowest-cost rates if you're going to put that to your deductible, which kind of seems silly in my mind.
Yeah, no, it's excellent, because that's something that has really worked for me. Is I shop. I actually use the your rate tables, and I can get my x-rays and different types of CT scans or anything like that at a fraction of the cost. I think I save 75% every single time I access the system right now because of what you guys offer. It's available. I think, they may not live in the Southeast, my listeners, I got them all over, but these are still the basic tenets and basic principles that you need to bring forward in your community to really look for innovative solutions. Most communities, or certainly the cities, are getting new innovative healthcare options like a HIPnation, and they've just got to go out there and really look, because there are options out there. You can save money, you can become a better consumer, but you need to become a consumer. It's because, again, you research your car, your vacations, where you're going to live, where your kids are going to go to school, everything like that, but we don't take care of our bodies ourselves. And so that's the part that I was so excited to do the show. But Dr. Hill, we actually are at time. But I will certainly have you back. I know we have so much to get to. You and I always have a phenomenal conversation, but we are at time. So I truly appreciate you joining the show today, my friend.
Thank you, Justin. I appreciate you, and I appreciate everything you're doing out there to make healthcare better for your listeners and those who get to intersect with you.
Thank you, man. And Dr. Hill, again, thank you very much. And everyone, thank you for joining us today. And please tune in weekdays at 2:30 p.m. Eastern, 11:30 a.m. Pacific to hear our latest shows. And again, we have a special 3-hour show coming August 28th. That's a Wednesday from 11 a.m. to 2 p.m. And you can join us right here on this channel and listen to us live. We're going to have the top 10, top 12 list of healthcare visionaries joining us like we do every year at the annual HIMSS conference, but we're going to have them in person as well in August. And always, you can track me on Twitter at HIT Advisor and use the hashtag ThisJustinRadio so we can respond to your comments from the show. Thanks, everyone, and tune in next week. Take care.